joining us on tonight's webinar for resources for mental health, and we'll talk a lot about health and wellness as well. My name is Stephanie Burke. I'm the Assistant Dean and Director of First Year Experience, and I'm here to moderate tonight. We have a bunch of panelists for you that are going to talk a little bit about the navigating a college, on and off campus mental health resources, and sharing their insights, how to maintain our health and wellness during these really challenging times. So you can use the Q&A feature tonight as we go through to submit questions for the panelists, and I'll try and organize those as we go. Once all the panelists have had a chance to share a little bit of information with you about the resources that we have here on campus, that's when we'll jump into the Q&A portion. So each panelist is going to share a little bit first. And we are recording tonight's session so that if you miss something or need to go back and check that out again, that will be available afterwards. So I don't want to delay us any further. A huge thank you to our panelists tonight. And at this point, I'm going to ask them if they will briefly introduce themselves before we hop in.
Awesome. I'm Brianna, and I am a therapist over in the Counseling Center.
I'll go next. I'm Lori. I am the Director of Student Support and Case Management Services, and I'm housed within the Dean of Students office.
And I'm Sarah Stevens, and I'm Medical Director at the Health and Wellness Center.
Hi everyone, my name is David Rubenstein. I'm the Executive Director for Health and Wellness. Glad to see you all.
Thank you all for being here. All right, well, we are going to hop in. We want to share with you a little bit about what we offer here at Lehigh. And so, Brianna, would you get us started and talk about the Counseling Center a little bit?
Of course. Steph, I want to thank you first for bringing us all together today. This feels like a really important topic as we head into the semester, and I'm sure lots of folks are wondering what mental health and physical health is going to look like on campus. So talking a little bit about some of our services in the Counseling Center this semester, we're really excited to say that our services are pretty much the same availability that they've always been. They're just going to look a little bit different. So instead of being in person in the office, most of our services are going to continue. They're just going to be remote. So we've been using Zoom, and we feel pretty confident that we've had enough practice over the spring and summer semester that we have a pretty solid understanding of what things are going to look like for us. So I'll go over just some of the basic services we have and how those have changed a little bit from what we typically would do before this COVID-19 era. So some of our biggest services that we have are certainly our individual therapy, which is pretty much a short-term model where you get to meet one-on-one with a therapist to talk about any concerns that you have, whether it's anxiety, concerns about stress, relationship problems, anything you can think of. You're certainly welcome to come in and talk to us in a one-on-one manner. We also have group therapy, which is probably our most popular service in the Counseling Center. It's a really big thing. The students at Lehigh really love it, and it's a really thriving program. And that's where you'll sit with about 6 to 8 of your peers, now virtually via Zoom, and talk about concerns, any anxiety, roommate distress, depression, concerns about your health or about COVID, trouble being home with family and trying to finish, your academic tasks and things that you're being asked to do, and really get a chance to relate to some of your peers and work on some relationships. Our number one thing that I think group therapy is great for, a lot of students use it when they're feeling homesick or feeling lonely. And so that's a really great resource we have. That's our long-term option for therapy. So some folks start weekly group therapy in the beginning of their freshman year, and they end up staying in through their senior year, graduating, and then even coming back for our graduate student group. So that's definitely a really popular service that we're really lucky and happy that we're going to be able to continue through the fall semester via Zoom. Some other things that we do, if therapy maybe isn't for you, or you're not sure if that's the option that you want to go with right now, we do a lot of workshops, both in-house and out in the community on campus. And these can look like a wide range of things that touch on a number of different topics. So they're typically between 60 and 90 minutes, and some are pop-up one-time sort of drop-in sessions, and some will be a 3 or 4 week rotating schedule that you can attend as many times as you would like. And some of our workshops that we do, again, they're all going to be via Zoom at this point, range from really practical, hands-on, how can I learn some strategies to manage stress, specifically related to isolation or doing classes remotely and what that looks like. And then we have workshops all the way through to an 8-week series to learn how to knit as a stress management technique, and everything in between building relationships, time management. And really the cool thing about the workshops that we do is that if we don't have one in-house that we're doing already that you're looking for, we're really excited and open to coming in and planning a new workshop with your group based on a specific need you have. We do this a lot with Greek life, with certain student organizations, with athletic teams, and we're able to come in and figure out what you're needing from us, whether it's we need some team building or we need some conflict management, or we're really just concerned about one of our friends or teammates and how can we kind of help them, what can we do in that situation. We also do any sort of consultation outside of those workshops. So if you're a parent, a friend, a staff, a faculty member, another student, and you're concerned about one of our Lehigh students, you're always welcome to come in and talk to us. And we can help you brainstorm and work through any ways that you can be helpful, whether it's having a difficult conversation with them or how to be supportive through something very difficult or something you haven't had experience with before. And then we can also connect you with other resources like some of our other panelists here today, if they can be helpful in their significant areas that they're working in. And then of course, I think something really important that we're going to continue through and is something I hope if you take anything away from today, you remember this, is our crisis services. So if you or any Lehigh student you know is ever in crisis, 24/7, we have a counselor on call that can talk to you and work through that crisis. Again, whether it's a really in the moment, just helping you calm down or having someone to listen to you, or helping you get connected with another resource, whether it's someone over in the Dean of Students, someone over in the health center, or even getting you over to an emergency room. And that's any sort of crisis, from it's late at night and I can't sleep and I'm feeling really anxious to I think I'm having a panic attack to I'm feeling suicidal or I'm thinking I might want to hurt someone else. 24/7, if you call our phone number, we'll still have access to that crisis line. And so that feels really important to continue through the semester when folks will a lot of times be at home in their dorm and be a little isolated and feel like they don't have the support they might typically have during a normal semester or when they were at home in college, in high school before they came to college. I think those are our biggest services right now, just to kind of touch on. And I'm sure we'll have time at the end to go over any questions that folks have about any of those services.
Great. Thank you, Brianna. We really appreciate it. All right. Dr. Lori Gray Evans, you are up.
Thank you very much. So I'm a big fan of Lehigh. I've been around for 23 years. I started as a grad student and liked it so much I stuck around, and my first position here at Lehigh was a staff psychologist in the counseling center. So I'm very familiar with the staff there, the services that they provide, and I work closely with them on a weekly basis, assisting students. Through that work at the counseling center in collaboration with the Dean of Students office on students who are really struggling, I moved over to the Dean of Students office to start what we call the Student Support and Case Management Services Program, which is basically an early identification, intervention, and response program for students who might be at risk for academic or personal decline. And it's a way to centralize incoming communication about students who are struggling, but also to help refer them and get them to the place that might provide the most support. So I don't provide therapy in my office, and that's not the role, but we do a lot of evaluations and assisting students to get to where they need to be. It's also a good resource for parents to reach out to if they're concerned about their student and not sure what might be the best resource for the student, so that we can work with a number of offices to create an individualized plan to assist the student. So there are a number of ways that people can let us know that students are struggling. Certainly we hear about concerns from the residence halls, from the academic support staff, from faculty, sometimes from campus police, and certainly through our collaborations with the counseling center and the health center. But we also created a student concerns report form for any student, faculty member, staff member, family member to report concerns about a student who might be struggling so that we can reach out to them and make sure they don't slip through the cracks. The other thing that we do out of my office is that we chair the care team, which is a way for a group of student campus professionals to get together every week just to identify students who might need additional help so that we can reach out to them. And we also have what's called a health review process anytime that there's some type of an emergency that's affecting a student's ability to function. We have the counseling center, the health center, and then my office will meet with the student to make sure that we can put together a comprehensive support plan to assist that student moving forward. So in essence, I'm kind of like that point person for mental health concerns in the Dean of Students office. And I talk to many of the people who are hosting this webinar today on a regular basis so that we can coordinate and collaborate services for students. And that's pretty much what I have.
We appreciate it. All right, Dr. Stevens, you are up.
Thank you. Yes, so from the health center side, so in the Student Health Center, we provide acute and, whoops, I am so sorry. We provide acute and non-acute care for students. This year is going to be different than previously. So to mitigate health risk for students and actually for our staff, we're going to have 2 separate locations. So on Johnson Hall 3, which traditionally was our only place, that's going to be our location where we're going to be able to see students who have COVID-related symptoms. And anybody who follows the CDC list of symptoms knows that list of symptoms has become quite long over the last few months. So it's not even just respiratory symptoms. So fever, cough, headaches, abdominal pain, nausea, vomiting, diarrhea. It's a pretty long list. But we're able to see the students in Johnson 3, and we are just finishing a renovation of some space in Tremblay 7 and 8, which are 2 3-bedroom apartments, which are now going to be our kind of satellite clinic. And in that area where we're going to be seeing students who have non-COVID related symptoms. It's also in our staffing, we have nurses, medical assistant, nurse practitioners, and physicians, as well as our administrative staff. So our staff is also going to be split between these 2 locations. Students are going to access our services, and it's going to look a little bit differently this year. So for first years, you won't know the difference, but you might have experienced many of these things if you've had to access healthcare on your own in your own communities. My perception is that healthcare in most communities across the US has changed how it looks significantly over the last few months. So what students can do, they can either call the health center. So say if a student has symptoms or they're worried, you know, I have a fever, I have a headache. They either can call us directly, or they can go online through our electronic health record student portal, and they make an appointment. This appointment will be for essentially a clinical provider or nurse to call them back and do an assessment and a triage over the phone. What that does is allow us to, some things we can handle from beginning to end on the phone or via a Zoom visit. So it's going to be more of a telehealth, which again is new for us. We did not used to do that. Everybody pretty much could come in and see us. So that's a different process. For students who we can't complete that by telehealth, and there's many things in healthcare that can't be completed by telehealth, then our staff, when they talk to the student, will determine whether that's a student who we can either see in our non-COVID symptom-related area, or do we need to make an appointment in the area where we have COVID-related symptom assessments, or does that person need to go to the emergency department? And we are I know we're going to be more likely to send more students to the emergency department. So for instance, students who have a fever and are short of breath, we are not likely to bring them into the health center. because they're going to need a more expanded evaluation, honestly, than what we can really provide in the health center. So people need to be a little bit aware of that. So when students are scheduled to come in and see us, they'll be given a time. We ask them to, when they get to the health center, to call in from the outside. Again, this is a different thing for us. We're used to having a waiting room full of people. It can't look like that now. So students will call us when they get to the health center. Our clinical staff will come to the door. We'll bring them directly back to one of our clinical exam rooms, and we've rearranged kind of how things look back in our health center. And we will do essentially an efficient visit. We also have the ability to do specimen collection for COVID testing. We're working on having a test machine and the ability to do testing right in our office. As people are likely aware, there are testing capacity issues across the country that have impacts literally every day, change up availability and turnaround times for tests. We are not immune to that. We are doing our best to have multiple options for testing, but people need to understand that it's not going to necessarily be an immediate, I call, I come in, I'm tested, I'm good to go. But our goal is to do that. It's just, it may not always be possible. And so after students are seen, then we make a determination. If we have a student with a positive test, whether it's right that minute or one we get back a few hours or the next day, we have a whole process set up which really pulls in multiple entities on the university campus. So we have separated out what we call isolation housing. So there's 3-bedroom apartments. So students who have tested positive can be cohorted for isolation in those areas. They will be provided with linen, hand sanitizer, cleaning supplies, food and meals will be delivered to them, but they need to stay in that location other than seeking medical care and obviously medical care and emergencies. Then we will also do contact tracing, meaning we need to identify, and we work with the Bethlehem Health Bureau. We will work with the university if we need to get class rosters, team rosters, whatever we have to do to identify other people who were in contact with any case. And then we work to make arrangements for quarantine. Students need to understand that this year, unlike other years, all first-year students being housed on campus will have a single bedroom, and there's a limit to no more than 6 students sharing a bathroom. So the idea is that's going to be more of a family unit. So if one of those family members, if you will, develops COVID and is relocated to isolation housing, the other students who are on that family unit will quarantine in place in that residence hall location. So what that means is the other 5 students will need to stay in that location for a minimum of 14 days. We are going to be doing some testing of close contacts. So likely all those students will have a COVID test. If it's negative, they still have to complete their 14 days of quarantine. A negative test does not remove them from that process. So if it's positive, though, we will relocate the positive over to isolation housing. And I bring a lot of this up so students and families understand that at any moment, literally, their status might change. They might need to go to isolation. They might need to be quarantined with their suite mates. So people need to be aware of that. Some of the services in the health center are going to look a little differently. We are not going to be doing albuterol nebulizers. If somebody has asthma or has a history of needing an inhaler, they absolutely need to make sure they bring their own inhaler. If they have a nebulizer at home, we would recommend they bring that along with any medication they might need. They can use their nebulizer in their own room, but we will not be administering any in our health center. if people are going to need nebulizer or are short of breath, we are likely going to be sending them to the emergency department. Other services that we've had to put on pause, and I can tell you it's been a little bit of a mental struggle for us because we don't like to pause services, but in the interest of safety, meaning reducing the number of people in the health center at a time, reducing the time students are exposed to other students, and reducing procedures that could put other people at risk. We will not be doing immunotherapy, at least for the fall semester. We can reevaluate in the spring. We're going to be putting on pause any initial PAP tests. And again, that's something that we have always done. That usually doesn't apply to many first-year students because they don't usually start that till they're 21 anyway. But just mentioning that just in case. And many things we will continue to do. We'll continue to provide STD testing, contraception, evaluation for injuries. I can tell you, first-year students need to remember this is not a campus to wear high heels, flip-flops, because a lot of what we seem to see the first week is the twisted ankles. Then people realize they need running shoes. So if I can tell you one thing, wear good shoes your first week because you don't want to have to be dealing with you can't walk because you twisted your ankle. I think I covered those. A couple of other, I think, if maybe, and I don't know if I'm going off track, but sort of tips for people to help you are, it's going to be very important that students coming this year more than any year are sure that their health insurance covers their care in the Bethlehem area. So everybody might have health insurance, but if you have a plan that only provides, say, emergency department care in Bethlehem, it's going to limit it's going to be challenging for you if you need tests, medication, go to an urgent care, if you need an ambulance. So I encourage people, if your insurance doesn't have good local coverage, to buy the Lehigh student health insurance. I have no stock in it. I'm not out to sell it, but it is a very good plan. It's relatively inexpensive, actually, for good health coverage, and it will cover what you need while you're here. And the only other thing I would say is be aware that the local community also has shortages in supplies. So when I have gone to Target and I have gone to the store, it amazes me, one, the oddball things that aren't available, but the things that we all know aren't available. You go and the stores around Lehigh are empty as far as soap, hand sanitizers, wipes. I haven't seen any sanitizing wipe in a local store, and I don't go to many of them, but when I do, I always look, and there isn't much. So I would just tell people, don't expect that you're going to arrive and be able to go out and stock up on what we're telling you you need. So those are some of my thoughts, I guess, on the health center. But, we're here to help you stay healthy and help you navigate, and really to help you learn how to how to navigate managing your healthcare, because it's different. And you're coming in as a first-year student, not only learning how to navigate the healthcare system on your own, but in the middle of a pandemic. And we get it. It's a challenge. So we're here to help you. We have a very nice, understanding staff. And with that, I will pass it on to David.
Thank you, Sarah. Yeah, I would say that navigation has seemed to be the key theme during this time, during this period, and navigation through several different things. Navigation through a pandemic, of course, that is ever-changing and ever-evolving, that has impacted the campus and the region, the state, and of course the country and the world. But more importantly, I think navigating this time right now in your lives and your parents' lives, as you get ready to transition to come to college, come to university, and what an incredible, exciting time and transition just in and of itself, with so many amazing challenges and opportunities, and really the start of another time of your life. And just how exciting that is. And, you know, I have to tell you, the staff here at Lehigh is very excited to have you here. And we're also aware that we're trying to figure out how to help you negotiate, navigate your way through this time period in which we have this pandemic that is infusing its way through our country. But that is to say, as Brianna was saying, we have a counseling center that is very capable, that has wonderful staff that are absolutely there for you to help you navigate your way through this time period. And as Brianna was saying, the on-call services that are available 24/7, you want to take advantage of that. Always take advantage of that every time. And if you're a parent and you're ever concerned about your son or daughter, call the counseling center. This is what they do every day in and day out, and will help everybody navigate their way through this time period. And as Laurie was saying, there are a lot of offices throughout the Dean of Students office that are designed to provide support for students in so many different areas. Yes, of course, mental health, but also academic support for students with disabilities, for students that are just struggling with trying to find their way during this very new time period, and for many students in a brand new area, in a brand new campus, and trying to find their way through this period. And Laurie, I would say, as she was talking about just a minute ago, talks with multiple people every day throughout student affairs, and ensuring that students are getting the help and the support that they need. As Sarah said, this year is going to look different. This year is going to look much different. And to that end, a lot of energies have gone toward mitigating risk and taking efforts to mitigate risk at every pass, whether it's in housing and having students have single rooms and 6 students to a bathroom, to dining services, to how many of the offices and many of the services are set up across, and many of the activities are set up across the campus. It's designed to mitigate risk. And as we start the year, we want the year to be safe, and we want the year to be a healthy and safe campus. And so to that end, I'm sure that you read the email that you were sent yesterday from the Student Affairs Office around return to campus testing, and that all students who are living on campus, all students who are living off campus but have not elected or who have elected remote classes. So that's to say a little bit more clearly, all students who are living on campus and all students who are living off campus but attending some type of in-person experience are required to complete COVID-19 testing. You should be receiving an email in the next day or so that will have specific instructions about completing that COVID-19 testing that is being done by Vault Health. It is very important that when you receive that email, which you should receive tomorrow or the next day, that you very quickly log on to that link, provide the demographic information that is requested so you can receive your test kit the following day, assuming that you complete the information requested in the link by 3 o'clock. Once you get that test kit information, I would encourage you same day to log on to the system again so you can complete your specimen collection. And as quickly as possible, there'll be instructions on how to return that specimen back to the lab for analysis. That analysis, we should get the test results you will get the test results within 48 to 72 hours. So I share all that with you just to underscore the importance of checking your email tomorrow or the next day to look for an email from Lehigh University regarding re-entry testing requirements. So a negative test is required for students to come onto campus. And that circles back around to health and wellness and well-being and the importance of trying to sustain health on this campus in a pandemic that continues to unfold around us. And of course, to remind everybody that things will look different on this campus. And it's towards really two efforts. One is to maximize the student experience that really promotes, I think, academic enrichment and academic fulfillment, as well as the unique experience that college brings with being around other people, other students and staff and faculty that make the college experience so rich and so rewarding and so exciting. And our services and student affairs are really designed to try and do that as we've evolved our services given this pandemic. So I wanted to welcome all of you to the university. As Sarah said, it's a beautiful university, but bring your tennis shoes. Just, I think, get ready for an exciting time, and it is going to be different. But even with it being different, there are a lot of really wonderful opportunities ahead, I think. And we're here to try and make those opportunities really the best they can be for all of you. So thank you.
Thank you to all of the panelists. I'm going to jump in because we have a good number of questions here and they range in topics. So we will try and get to all of these, I promise. Let's start a little bit. I think there's some concern around socialization and isolation, right? With if we're talking about 6 foot to a floor and quarantining and these pieces. So does anyone on the panel want to hop in and talk a little bit about, you know, what's some advice about the practicality around not feeling isolated in that sort of situation, and how do they reach out? Where do they go to meet with a friend? Where should they go and study? Those kinds of practical things where you would normally be able to make connections a little bit more easily. Does anyone have any advice for that?
I think I'll start with this one because it feels pretty relevant to some of the things we do. So I think most of us have mentioned that things are going to look really different this semester and this year at Lehigh. And socialization and being worried as a first year coming into college is not so new. It'll just look a little bit different with some of those added factors you were talking about, Stephanie. So having family units and having remote classes, being smaller number of students in your dorm. And the Counseling Center is only one many offices on this campus that I think are there to help students, especially first year students, especially students who aren't going to class, who aren't getting to interact in person as much as they would like to do some of that socialization and minimize the opportunity to feel really isolated and feel really alone and make connections with brand new people. And so, like I said, the Counseling Center is one, but all of student affairs, I'm thinking about the Pride Center, the Office of Multicultural Affairs, Health and Prevention Strategies, a number of different offices, Office of First Year Experience, are going to be putting on a lot of different remote virtual events that feel really important to take advantage of at any time, because there's not going to be a lot of opportunity outside of that to do large kind of gatherings like this. So definitely in-house, you know, I spoke a little bit about group, and I think that's a really key place where some of that connection can take place. And some of our workshops for folks, even if they're not local, but they're living at home and still wanting to have connection, we held a social support kind of just gathering for folks to come and talk about anything and everything, whether it was hike that they went on that morning or the video game they were playing last night. And so that's another key place to take advantage of some of those things. But like I said, I think jumping on as many opportunities as you can from as many offices as you can is really going to be key this semester and this year going into that. I know for the Counseling Center, I didn't say before, but I will say it just to remind you that we're one of the only offices on campus that's completely confidential. We're one of two, so us and the Dialogue Center. And so talking to us, there are some great folks over in the Dialogue Center. You could always reach out and talk to Rabbi Nathan, is a wonderful person to talk to, is where you'll have a little bit more privacy in what you're wanting to talk about. And if you're not concerned about that and you're just, you know, connection, maybe meet some new people or make friends, I think taking advantage of as many opportunities as you can is going to be really important. And if you're wanting, I saw a question that feels related to this, to get involved in any of these things I'm talking about for the Counseling Center, you can certainly call either of our phone numbers or shoot us an email. That you can find all of that on our website. And another great thing to follow is our Instagram. So we just started an Instagram in the spring, but it's at Lehigh_UCPS. And there we're really trying to promote as much as we can with as much updated information as we can about different services, about any videos or new things that we're collaborating on with different offices in student affairs. So that'll be a really important place to catch some of that info.
I see some questions related to that, so I'm just gonna tack that on. Is it hard to get into group therapy? Is it hard to get get counseling services? Can you speak a little to that?
Yeah, so I say this with a reminder that this semester will be different, and we don't know kind of what that will do to accessibility to our services. But in the past, I think something that staff at the center really prides ourselves on is that we're making sure that students are being seen. We never have to schedule folks out for more than 1 to 2 weeks, and that's a pretty big deal. If you're calling to get in for an intake or a first appointment, we'll typically get you in that week. And Lori can probably speak to this a little bit better than I can, but it seems like that's been the case for a number of years. So we do a really good job at managing our load and making sure that students are getting access to the services that they need. As far as our groups are always really full, and we're always adding new groups when that happens. So just to give you a little bit of an idea in numbers, Lehigh typically runs between 8 and 10 undergraduate groups a semester, and 1, maybe 2 graduate group therapy groups. And that's comparable to a school like Penn State, which is obviously much larger. They usually have around the same number of groups. So they're usually full, and we usually are making sure that we have enough access. If they fill up, we're adding them in. Typically, we have a later afternoon and an earlier afternoon, so there's some flexibility in day and time for folks to join. And we don't know what that's going to look like this semester. Because there are some constraints around who can actually engage in our therapy services, so our group therapy and our individual therapy, just because of our licenses and where we have jurisdiction kind of in that state. We can only see students for therapy if they're living in Pennsylvania or New Jersey right now. And that might change as the pandemic changes. I know in the beginning, those restrictions loosened up a little bit, and so we were able to see more folks. But so we really don't know how full our groups are going to be, but I know we do a really good job of being mindful and thoughtful and making sure that if there's a demand for groups, we're going to add more groups and open up more groups.
Thank you. You know, there's a little bit, I think, suggestions on the specifics of, I think folks want to hear a little bit more about like where or how do you do a remote event? Is there a way to do that while still socializing and connecting with other folks? So could anyone speak to that a little bit, advice or thoughts? I know there are tents going up around campus. I know, you know, those might be some suggestions in there.
I think the Counseling Center has spaces available for students for remote counseling services. So throughout the campus. So if a student feels that they feel their own room feels private enough to have a counseling session remotely, that's certainly available to them. There's also spaces in Johnson Hall as well that students can elect to come into to have a remote session if they're choosing to have a remote counseling session. The Counseling Center, as Brianna I think also says, offers both in-person and remote. I think what's different this year is that there's an emphasis on the remote for obvious reasons, but the Counseling Center does offer both in-person and remote. And there are spaces on campus for students elect to have the remote services, whether it's in their room or other spaces on campus.
Stephanie, I want to speak just a little bit about what does social engagement look like during a pandemic. So we have an office of student engagement We have 4 staff members who work to create programs for students almost daily, sometimes multiple times a day. And they especially work hard on this to help the first year students connect in and get to know each other and form friendships. What that's going to look like during a pandemic, I think is going to be a little bit different. They've been working all summer and even last spring on trying to create Zoom and online activities so that students can at least feel connected to their friends and their peers. If you go to the Student Affairs website and look at the Office of Student Engagement, they publicize multiple activities and ways for students to get engaged and connected. And so that's one way. Another thing that students can do is they can talk to the Griffin on their residence hall. There will be a Griffin on each hall so that students have somebody at Lehigh who can help them connect with others and figure out how to navigate the system. And Stephanie, I don't know if you, with all of the first year activities, they've shifted a bit in comparison to what we've done in past years. You might be able to speak to as far as what some of those activities might look like initially.
Yeah, and we're going to talk through, for folks that are on campus during orientation, I think that will be a topic of conversation. And so the orientation leaders are going to be there. Granted, the orientation leaders will be virtual, but they'll be able to talk through with the students and get them thinking around, all right, how do you rally folks to go to dinner together, right? Some of it's going to be on the individual students. I talked with a parent I know today that was concerned that, well, can they go to the dining hall together? Yes, they can. Certainly in our spaces, right, we're wearing masks and we're 6 feet apart. That is a safety guideline that we're going to be following, but it doesn't mean that folks can't get together and sit on the front lawn spaced out together. So it's not that they're going to be locked in their rooms. Certainly they could still gather with other people. It's going to look a little different, socializing with your mask on. If you're, when you're in close quarters with other folks, it's not the same, but it's the world that we're living in right now.
I would also add the Health Advancement Promotion Service also offers a lot of activities throughout the semester for student engagement. And I know that they have a lot of activities that are scheduled for the fall semester. As Stephanie said, it is going to look different with social distancing as well as face coverings. And still, there'll be opportunities for student engagement with each other, just with the caveat of maintaining and sustaining health and wellness and well-being on the campus. I know there were some questions regarding testing too, and Dr. Stevens wondered if you could take a couple of those questions regarding the testing, and also a parent ask a question about if they could just bring a student home and things like that, and maybe you could speak to some of that.
Yes, I'm unmuting. So I apologize, I didn't scroll through and see the specific testing question. Was that a question about the pre-screen or the pre-arrival testing or point of care testing?
Question around, like, if someone feels sick and tests positive, then are other folks automatically tested? I'm looking to, there were a few, so scrolling through. David, what happens if tests are inconclusive? Will it be repeated?
Got it. So the inconclusive one. So what I can tell you with inconclusive is the pre-arrival testing is, it's saliva based, it's an antigen test. That test is going to be administered through Vault, which is the company that is going to provide the specimen collection kits and the Zoom observed saliva collection. And then those tests specimens get returned to Rutgers, the lab at Rutgers. My understanding is that what happens is the test is run. If it comes back inconclusive, which is my understanding is if the level is low, then it's not a clear positive, it's not a clear negative. So what they do is they they thaw that specimen and they run that specimen again. So they'll do that the same day. If it's still inconclusive, then the student might need to wait another 1 to 2 days and repeat it, because the issue might be that somebody is becoming, developing enough of the
infection, that the kind of viral load, if you will, or the antigen load is increasing, and you have to give it a little bit of time and see what's happening. If that test comes back positive, then these tests, the specificity is good. So that would be considered a positive test. If that test, again, is the pre-entry, then students will, you'll be contacted. That contact, unless the Health Bureau that gets that reported through the national reporting system, and that's required by law, every now and then when we get positives, the health bureaus will actually kind of beat us to the student, if you will. We try, when we've ordered the test out of the health center, to be the first one to call the student because we've had that relationship. But regardless of whether it's the local health bureau for the student or the health center, we'll provide information. Once somebody's positive, the current CDC guidelines are that it's a minimum of 10 days of isolation. So that student would not be able to come to campus for at least 10 days. So yes, students would, I'm assuming at that point, students are either home or wherever they are, and they would need to complete that isolation period. So that would be the inconclusive. I have to say we have not, from the health center, when we send out labs, and we've been doing this since March, actually March, we haven't gotten any inconclusives. We get positives, we get negatives, and we manage accordingly. Those have been nasopharyngeal swab. They're the molecular PCR test. So it's a different test process. We just have not had inconclusives. If we did, it would be a similar thing that we would have to repeat that probably in a day or two. The issue about, what was the second part of your issue, Stephanie? It was the isolation process if they're on campus?
So there's a couple of questions about the family unit. If one person feels sick and tests positive, then the other folks are automatically quarantined, and then could a parent pick up a student who is in a situation where they're quarantined?
Yes, so there's two things. So once students are on campus, so our hope is that if everybody is doing the social distancing and the cloth face coverings and just really working at that's going to diminish or decrease the cases or symptomatic students we have. But we are full aware that we are quite likely, and I'm certain we're going to have positive cases. When we identify a case, people with a positive test will be relocated to isolation housing. So right now we have, I think there's about 120 isolation beds. Those are in apartments in Tremblay. If people have a positive test, they can be cohorted with somebody else with a positive test. They will be in an apartment with the potential of 3 students, each with their own bedroom with a shared bathroom. Again, those are students who definitely all have positive tests. The other people who are the close contacts, so say student, I don't know, David Rubenstein has COVID, so we put him in isolation housing, and the other 5 students who are on his residence hall family unit, pod, whatever you want to call it, they will need to quarantine. Yes, a family can come get a student who is in isolation or in quarantine. If a family, if a student would have to go by plane, train, bus, public transportation, Uber, I don't want to completely say they wouldn't be allowed, but they would be strongly encouraged to stay on campus because we don't want to put the Uber, the public train, the plane full of people at risk for also becoming ill. But again, families could come and get the student who's either quarantined. Quarantine refers to needing to kind of separate somebody who has been in contact, and they basically just need to be observed for the duration of time, essentially kind of the incubation period of the infection. So for COVID, that's up to 14 days. Yeah, it's kind of boring. I would have to say that I feel much more comfortable knowing that the housing plan changed from, I don't know if you're familiar with what Lehigh's usual residence hall housing is like, but my understanding is there previously in normal times could be up to, say, 20 plus people on a residence hall sharing a big bathroom. And really to try to mitigate that risk and to decrease the number of students who will be impacted when there's a positive, I'm much more comfortable that each student will have a private single bedroom and will only be sharing bathroom space with 5 other students. So, you know, that's similar to kind of a family. If you have a family, there's 4 to 6 of you maybe in your house. So again, the quarantine, it's not, and you'll be quarantined with the other people in that kind of pod. So the more you can kind of stay separate, the less likely you are to maybe have ongoing exposure to somebody who's sick. Again, it's about mitigating risk. Yes, we will be doing testing of contacts. So we will be having students who say are in that group of 6 come for testing. If their test is negative, we're glad, but they're going to need to stay in quarantine. If it's positive, then that student will also be relocated to that isolation housing. I don't know if that clarifies enough for people. I did want to answer 2 other questions that I saw in the Q&A while I'm on a roll here. One of them was, are there going to be flu shots? We have had a couple of years of very successful flu vaccine campaigns. And so we're working this year. Last year, let's just say we had, I think, 840 students roll through Lamberton in one day. That is not going to be, it's not going to be able to look the same. But we are working on how to ensure that everybody on our campus can get a flu shot. So we are working on the logistics. And flu shots usually aren't administered till usually kind of the beginning of October. But we're working on that. And the other question I saw was how much hand sanitizer to bring. That's a very good question. You know, one thought would be to bring, the university will be providing everybody who comes on campus with whatever you want to call it, welcome kit, swag bag. It's going to have 2 Lehigh logo cloth face coverings. It's going to have a small hand sanitizer. I can tell you a 2-ounce one is not going to make it through the semester. And it's going to have a small battery-powered digital type thermometer, which we're also happy about. Because let me tell you, when you go to order things like thermometers in a 10,000 or something number, you can imagine the supply chain across the country has made that a challenge. So I'm really happy the university got that. So one thought for people, if I had to make kind of a guess, and I'm thinking about how much hand sanitizer I've gone through in the last couple of months, I would look at it and say, you probably want like a 16-ounce bottle, if you can get it, maybe per month or 2. Think you're going to be on campus for about 3 months. So if you can bring that amount and you can refill your little small one that you're going to carry around campus with you, I think that's a good idea. I would also encourage people to look on the I think it's on the FDA, their list of hand sanitizers. Some of them have been found to not have an adequate percentage of alcohol, so you don't want those. Those just got added to the list this week. There's also on the list ones that were contaminated by methanol, and you obviously don't want those either. So I would Google, I'm pretty sure it's on the FDA's site, the alert about the hand sanitizers of all crazy things to think that you need a health alert about. Was there another question I was supposed to answer?
I think you caught them.
Okay.
Thank you. Our time went quickly today, so I apologize. I know there's a couple of additional questions, and I promise you that we will work to get you those answers, and want to make sure that folks know to check absolutely the COVID Information Center website. There is a very thorough FAQ there, so sometimes your answers can be found right there really quickly. I know our offices are all working diligently to answer questions that come in via phone and email. You are always welcome to call the Office of First Year Experience or email the Office of First Year Experience, and we can filter you to the right place if we cannot answer your question. But at this point, I want to thank the panelists for joining me and sharing about all of the great resources and answering questions. I want to thank the students and parents that are on the call today. Really appreciate you joining us and hope that we got at least a good number of your questions answered. And we look forward.
I think Dr. Stevens had one other thing to add.
Sorry, yes, jump in.
Yes, actually, what I was going to say is, and I apologize for this, so the one that's going to Rutgers is the PCR, but it's saliva, it's not nasopharyngeal. The one that we're working on getting, but those have been, they've had some inconclusives. We have not had any when we've done them as nasopharyngeal, and we've only done them on symptomatic students. So my error. But we are, regarding the antigen test, one of the things we're looking at doing in the health center as a kind of a stopgap measure while we're trying to get the PCR molecular test available in our office is an antigen test. And to the question there, if it's negative, you follow it up. Yes, that is one of the issues with the antigen tests, is that their sensitivity is significantly lower. And when it's negative, if it's positive, it's positive. We're good. We know it's a positive. If it's negative, yes. If we end up with that machine, and right now there's some supply chain issues for machines and supplies, which is a bit of a sort of hiccup, I would say. But yes, if it's negative, we will be sending it out for PCR testing. So thank you for whoever pointed that out.
Thank you, Dr. Stevens. All right. Well, thank you all so much for joining us tonight. We really appreciate it. And we look forward to the start of the year. This recording will be available on the Virtual Admitted Students events page. We'll also put it on our Office of First Year Experience YouTube page for folks to see. So thank you all so much. We really appreciate it. Good night.